Now, moving, we just want to actually talk about the epidemiology and risk factors for someone having a pelvic inflammatory disease. Okay, so epidemiology is you just trying to look at how this disease condition has affected the world at large. Risk factors, of course, is like what now made it easier for someone to actually have it. So this is a rough image trying to show the epidemiology, and this is the key here. All right, this is the key here. I think everything you see here, you should multiply by 100,000. Okay, so pelvic inflammatory disease, this is it. Inflammation of the uterus, inflammation of the fallopian tubes, inflammation of the ovaries. Okay, so it's a common and a serious reproductive health issue, and it affects a lot of people globally, especially women that have reached reproductive age. Okay, so a rough look at the epidemiology, that's how it has affected the world at large. We said that it actually affects about 1 million women yearly in USA, with significant numbers worldwide. So the age group of people mostly affected are women that are within the reproductive range. That's age 15 to 49, particularly those under 25, due to cervical immaturity and higher risk of sexually transmitted infections. So geographical variations is higher in regions with limited access to sexual health education and sexual transmitted infection screening. Okay, so long-term impact is it's actually a major contributor to infertility, ectopic pregnancy, and chronic pelvic pain. Okay. So major risks now. If you have had infections from chlamydia trachomatis or Neisseria gonorrhoeae, it's a risk. So these bacteria are sent from the lower genital tract to infect the uterus, fallopian tubes, and the ovaries. If you have multiple sexual partners, you have sex with many people, then young women are actually more vulnerable. Then if you have histories of previously having the pelvic inflammatory disease or other types of sexually transmitted infections, there's also a higher risk. If they have placed an intrauterine device in you, if you use all those scented products on your reproductive system, low socio-economic status, then if you smoke, all of these are risk factors, okay, for pelvic inflammatory disease.